When allergy season hits, we usually think of sniffles and sneezes, not really so much about heart health. But new research shows a growing link between long-term allergy inflammation and increased risk for heart issues. Interesting. Dr. Nora Lin, an allergist from the Philadelphia area, is joining us live to explain how managing your allergies might also help you protect your heart. Good morning, Dr. Lin. We appreciate your time today. Most people don't really connect allergies with heart health. So what is this link that you guys are uncovering here?
Yes, well, we normally think about allergies as just runny noses and itchy eyes and sneezing, um, but the lungs are definitely connected to the heart. The organs work together, and so what often happens is the spring comes, people start feeling their runny noses and sneezing and itchy eyes, and they start reaching for their allergy medicines. Um, but a lot of these allergy medications can directly affect blood pressure and heart rate. And so it's important to know that there's a connection and that those medicines can then affect their blood pressure and their cardiac health. Also, as the spring hits and the weather warms up, people want to go outside naturally and do their outdoor activities, take longer walks, do their gardening. But breathing in the pollen that comes with the spring will then lead to inflammation and more symptoms. And if they have asthma as well, then that can trigger their asthma, which then can affect their heart in many ways, whether it's the blood pressure, whether it's the heart rate, whether it's making it such that their breathing can limit their ability to exercise and be outdoors. There's that direct connection.
So it sounds like there are many different factors here, whether you have the allergy medicine, whether you have an asthma condition, or really the inflammation too is a factor here. So how did you guys find this link? I'm curious. Is it just studies from over time? And if so, what did you guys study specifically there to uncover that?
Well, I think if you're referring to the study from Dr. Jog, so I wasn't directly involved in that, but I just know I've been a clinical allergist for 20 years now, and so I'm really on the ground level, seeing patients as they walk in the door, and we work them up for allergies. Um, Actually, one important point is that there are many times where patients assume that what they've been experiencing for years with their runny noses and coughing, congestion is allergies. And it turns out when they finally get a formal evaluation that it often is not allergies. There are a lot of mimicking conditions. So one point I want to make is that it's really important to get the diagnosis correct. Because then reaching for allergy medications over the counter may not actually be the right thing to do. Um, but these same patients that walk in my door, many of them have common, cardiac conditions like elevated blood pressure, hypertension, um, arrhythmias, you know, heart rate can different heart conditions, and so uh, it's important we look at their whole clinical picture and tailor their treatment regimen based on their entire medical history.
So let's say for the person sitting at home watching this interview, and they are an allergy sufferer like I am, and they don't necessarily regularly get that checked out every single year. It's allergy season. We're just going to get right back on our allergy regimen that we normally take. Is this now something that if you are a regular allergy sufferer, is this something that you would recommend maybe those allergy sufferers go to the doctor every year to get checked out even more frequently? I guess what is your recommendation now with this study out?
Well, I would suggest that if you're a frequent or a long time sufferer of allergies or suspected allergies, I definitely think it would be helpful to ask your doctor for a referral to see an allergist. Not all places have access to an allergy specialist, but I think if there can be access to an allergist, it's incredibly helpful. Not only can you get a formal testing done to see what exactly your allergies are, which then can tailor your treatment regimen, But we can also screen for whether or not you have asthma. Asthma can be silent. I've had many times where patients had no idea they had asthma until they were actually evaluated, and it turns out they did. So we can provide that service. And and if you have asthma, which many people discover they have asthma, then they can get that proper treatment, which then in turn helps them with their cardiac health as they can then do their regular exercise, which will improve their cardiac health.
Yeah. Are there maybe common allergies, allergy medications that people should be cautious of if they have a heart condition?
Yes. So some of the common over-the-counter medications are your standard antihistamines, like Zyrtec and Claritin, Allegra, etc. And then you have decongestant medications, Sudafed being probably one of the most popular ones. Decongestant medications are very helpful for congestion, but they do have side effects on blood pressure and heart rate. And so for those people with hypertension and blood pressure issues, that's important to know.
What should somebody do if they're unsure whether their symptoms are allergy related or heart related?
Definitely talk to their primary doctor first. And like I said, I would ask for a referral to an allergist. I think that's a good first step.
And what sort of picture would that allergist be able to paint them? So if we go to the allergist, what are we going to learn?
Well, you will probably undergo some skin testing, which we test for common things like pollen and dust and mold and pet dander. These are all common exposures that people have. And you can be tested to see if you have evidence of allergy to those things. And then we do an assessment of your daily exposures, your indoor environments, your outdoor environments, and help guide what time of the year maybe you should be taking allergy medication. Maybe it's not only seasonal, maybe you need allergy medications year round, and maybe modifications to your indoor environment to help mitigate exposures to those allergens.
Let's talk about allergy shots. I know we kind of overviewed the over-the-counter medicines that you can use and how that impacts heart health. What about allergy shots? I know that many people go for that as opposed to taking that pill every 12 to 24 hours. But what about allergy shots and how does that impact heart health?
Sure, yes. Allergy immunotherapy is a what we call allergy shots, and it is a form of desensitization. So what it allows people to do is we actually give injections of small amounts of the allergens that you're allergic to, which over time builds a tolerance and desensitizes you to those allergens. So it actually makes you less allergic over time, which then allows for less symptoms and less need for medication. So it's it's great for those people who really would like to minimize taking medications, and has a long-term effect. So the shot course is usually 5 years, but even after the injections are done, that desensitized effect lasts for many years after that.
And so in turn, does that help or hurt our heart health? Just so I have it clear.
Yes, it absolutely can help because anything that decreases your allergy symptoms will decrease the amount of inflammation in the respiratory tract and will in turn then decrease that inflammatory burden on the heart as well. In addition to not needing as much allergy medications, which, as we discussed, will then not affect your cardiac health as well. And be able to improve your ability to be outside and do outdoor activities and do exercise. Um, there's also, in our practice, we also offer drops under the tongue, which is an alternative way of doing desensitization. Allergy shots gets most of the attention, and allergy shots has been the traditional form of desensitization. But there are also drops under the tongue called sublingual immunotherapy, which accomplishes the same goal. You put small amounts of the allergens under your tongue, which then gets absorbed on a regular basis, and then that leads to desensitization.
Interesting. Okay. So if people are watching this, you know, your biggest piece of advice for people maybe managing both allergies and heart health this season, what would that be?
Talk to your doctor about the whether you have the right diagnosis of allergies and about the recommended medications to take. There are many medications over the counter. It can be a little overwhelming to know which medications to take, but I would talk to your primary doctor, see if you can see an allergist as well to get more information on allergies and possible asthma.
All right, Dr. Nora Lin, an allergist from the Philly area, we appreciate your time. Thank you so much for your insight.
Thank you for having me.
All right.